So members, the name of Rutamok Abdul, that's my name. I'm a fisheries officer by profession at Londis local government. So today we are going to look at the medical field, that is laboratory nutrition, then laboratory nutrition, pharmacy, clinical officer, nurse, midwife. So basically, as you know, our CV template, we start with the personal information, work experience, education background, certifications and trainings. Then we have computer literacy, competencies and skills, personal attributes, hobbies, and then the referees. So we shall start with the personal information. This is general for all the CVs, the medical, the clinical, midwife, and the like. You start with your name, your name in bold and capital. Then below it, your position, say laboratory technologist, a clinical officer, medical officer. Then below it, you write the facility or the name of the workplace. Then below it, you write the PO box address. Below that, you put your contact. Below, you put your email address. Then below that, you put the sex, the nationality, and the date of birth. So basically, that's what you should put in your personal information. I've not mentioned anything about the religion, the tribe, and also the religion, tribe, the religion, the tribe, your home area, because basically they can cause some bit of bias to the one who's employing you, so you shouldn't have that. So the next is the work experience. I'll start with the laboratory technologists. You have laboratory technologists, we have laboratory technician, we have the intern. For laboratory technologists, I'll give some kind of roles and duties and responsibilities that you should be having in your CV. We have collect and process and handle blood and stroke all other biological specimens according to the established procedure. Number 2, instruct patients in the proper collection of samples. Number 3, perform a variety of clinical laboratory tests in areas of hematology, microbiology, immunology, clinical chemistry, and urinalysis as assigned. Conduct quantitative and qualitative chemical analysis of body fluids such as blood and urine. Conduct blood tests for transfusion purposes. May draw blood from patient's finger, earlobe, or vein. Develop and maintain cell tissue cultures for testing purposes as appropriate. Isolate and identify specimens using laboratory techniques. Perform quality control on test results, ensuring validity and accuracy. Perform calibration, troubleshooting on testing systems and instruments to ensure adherence to the established standards of occurrence. Keep records and reports on results according to established procedures. Practice safety, environmental, all infection control methods. Then perform other miscellaneous job-related duties as assigned. So if at all you're into laboratory kind of work, that is laboratory technician, laboratory technologist, you should be having that kind of experience. And then make sure that you have some, laboratory technician, because you have a laboratory technologist and you have a laboratory technician, which is a lower position. You can write this: collect samples from patients into the appropriate container. That is laboratory assistant or laboratory technician. Collect health data and laboratory samples from the community. Assess specimens in the database. Perform sample processing and laboratory tests following standard writing procedure. Enter test results into the database. Report results according to the standard laboratory protocols. Perform routine permitted end-user maintenance of laboratory equipments. Clean and disinfect work areas, benches. Maintain the highest standards of biosafety practices in the laboratory. Then actively participate in the procurement of supplies and reagents for respective department. So if I told you laboratory assistant or laboratory technician or intern, you can put those roles and duties. They are better for you. So I think those are kind of and some of the areas you should be having in those in laboratory field: microbiology, parasitology, histology, histopathology techniques. You should be having them. General laboratory procedures. Yeah, so that's the kind of knowledge you should be having. Immunology, molecular biology, biotechnology. So if you're in the area of laboratory, you should be having those kind of those areas. Yeah, so that is laboratory work. So let me go to the medical doctor, the roles and duties. We're on work experience. Now for medical doctor, that's your position can be medical officer. Some of the roles and duties you may be having, we have responsible for playing the role in the diagnosis, treatment, and management of patients. That's your first role. Ensuring the high standards in patient care is maintained. Evaluating patients and referring them to specialized health care stroke consultants, because you have consultants. If you're a medical doctor, you can refer them. Actually participating in the delivery of quality health care to patients. Adhering to the professional code of conduct and ethics. Taking part in outreach and health programs. Participating in research activities and data collections. Compiling and submitting periodic reports. Proactively participating in continuing professional development programs. Reporting the senior management, as well as liaising between the administration and medical staff. So those are roles of a medical doctor. I can get some more. Let me see if I have some more here. Medical doctor. For that, let me just give that. Maybe I can give others. Maybe if I told you in a specific department, maybe if you are like in the surgery, yeah, you are in intern in surgery, or you are in surgery, you can have this kind of roles and duties. You can incorporate them there. Consulting with patients to understand their symptoms and health concerns, number one. Diagnosing and treating acute illnesses such as bacteria and viral infections, as well as chronic disease conditions such as hypertension, heart disease, or diabetics. Prescribing all administered medication, therapy, and other specialized medical care to treat or prevent illnesses, disease, or injury. So you can also put them in your roles and duties. Explaining procedures and discussing test results or prescribed treatments with patients. You, as a medical doctor, should be having that. You'll be knowing that. That's a role you can put in your CV. Providing health awareness and providing health and wellness advice to patients, which may include diet, physical activity, health, and disease prevention. Maintaining detailed notes of appointments with patients, including comments, tests, or treatments prescribed, and test results. So as a medical doctor, you should be having that. Providing support and advice to patients receiving long-term care. Yeah. And preparing official health documents or records when necessary. So as a doctor, you should be having that kind of that kind of roles and duties. If I told you a medical doctor, should include that. So let us go to maybe the clinical officers. Medical clinical officer, what role and duties should be having in your CV? I can start with 1, diagnosing, treating, and managing patients. Then, contributing clinical expertise to patient care and providing guidance to junior physicians as a clinical officer. Performing administrative activities and risk management. Ensuring the highest standards of patient care are maintained. Yeah. Verifying diagnosis and facilitating treatment plans. Another role, supervising and mentoring healthcare professionals. Here include the nurses, lab technicians, and other collaborative consultants. So as you as a clinical officer, you can supervise and mentor them. Then managing allocated budgets, identifying areas of improvement in patient care. As a clinical officer, should be having that. Then keeping informed on advancements in the field and contributing to medical research programs. As a clinical officer, they may have a program and you have to contribute. Ensuring compliance in health regulations and safety standards. Then reporting to the senior management, as well as liaising between administrative and medical staff. And then ensuring consistent and accurate medical record keeping. So as a clinical clinical officer, you should be having those on duties. So if at all you're having one role and duty from one facility to another, you might change and write them in this way, so that you don't have the same. Yeah. One, you can say providing safe, quality, and clinical services to patients. Number 2, providing safe patient care during intra and inter-facility transfers. Then evaluating and referring patients to specialized clinical officers and clinical care services. Assisting the senior medical clinical officer to establish basic emergency care services for patients. Conducting referrals for specific services. Participating in continuing professional development programs. Then enforcing professional ethics and service codes of conduct. Then managing medical and information records. So let me just, that's what I can say on clinical officer. So we are still on work experience, but I'm going field by field, in the medical field. So let's go to the midwives. So a midwife, the roles and duties you should be having, enrolled midwife. 1, providing necessary professional care and services during normal pregnancy and childbirth. That's your first role. Second, providing the mother and care with professional care and services during the first 6 weeks after delivery. So it's different. Providing the mother and baby with professional care and services during the first 6 weeks after delivery. So it's different from the first role you do. Executing midwifery nursing functions in the care of pregnant women. Then monitoring and observing the condition of pregnant women. Then obtaining medical history and conducting screening tests as ordered by the physician. So you as a midwife. Then assisting mothers to be in the labor processes through midwife nursing care. So as a midwife, you should be having that as a role and duty. Providing follow-up nursing care to new mothers and their babies. Educating new mothers on breastfeeding, bathing, and dressing babies. So as a midwife. Instructing and educating mothers on related baby healthcare issues. Administering medications are prescribed by the consulting physician. So if at all you're working with the mothers and babies, then educating pregnant women or gynecological health care. Then instructing and counseling women on birth control issues. So as a midwife, you should be having that. So in the career of midwife, sometimes you may be an in charge or senior midwife who's managing other midwives. So basically, your roles and duties are different. So maybe what I can say about that, one, if you are in charge of midwifery, or if you are supervising midwives, other midwives, your first role can be taking in charge of management of daily responsibilities, including work allocation, deployment, and ensuring a smooth running of the area. So you are deploying other midwives. Then, working in partnership with women to give necessary support, care, and advice during pregnancy, labor, and the postpartum period. So as a senior midwife, yeah, or an in charge. Then assisting with deliveries on the midwife's own responsibility, and to provide care for the newborn and mother. So you're giving instructions. Then providing health counseling and education, not only for the women, but also within the family and the community. So as a senior in charge, you can give that advice. Then providing antenatal education and preparation for parenthood, extending to women health, sexual, all reproduction health, and child care. So as a senior midwife or an in charge. Then providing professional advice and support to other members of staff to ensure efficient and effective use of personnel and resources available in the facility. Then assisting members in team planning, priority setting, and decision making. Remember, you are under management. That role is more of management. Participating in development, implementation, and evaluation of quality initiatives. Contributing towards maintaining of a safe, therapeutic, and learning environment. Then mentoring junior staff and students, trainees, and visiting staff. So you as a senior midwife, you should be having those roles. So we are done with midwives. We are done with clinical officer. We are done with laboratory. So let's go to the nurse. You as a nurse, what are you expected to be doing? As a nurse, which roles and duties should you put in your CV as a nurse? One, you can write these roles and duties as a nurse. One, carrying out adherence counseling for patients on chronic care. Two, monitoring patients' conditions and assessing their needs to provide the best possible care and advice. You as a nurse. Observing and interpreting patient symptoms and communicating them to the physician. Triaging and administering first aid treatment to patients. Two, another, ensuring a sterile and clean environment during both major and minor operations. So that's the role as a nurse. Assisting during major and minor operations, as well as consultation rooms. Disinfecting, cleaning, drying, and packaging, and sterilizing surgical instrument and linen. Conducting pre and post counseling to clients due for HIV testing. Yeah. Collaborating with patients and other nurses to devise care plans for individual patients, to devise care plans for patients. Then performing routine procedures, that is blood pressure measurements, administering injections, etc., and filling in patients' charts. So as a nurse. Then adjusting and administering patients' medication and providing treatments according to the physician's order. That's what you do as a nurse. Inspecting facilities and acting to maintain excellent hygiene and safety. So as a nurse, that's what you should be having in your CV. So roles and duties, don't miss out on any of those. So we are going to go to the pharmacist and the dispenser. So maybe I'll start the roles of a dispenser. A dispenser They can be in the pharmacy, they can be in a medical center, yeah, or a hospital. 1. A dispenser roles and duties: compiling drug needs and generating orders for essential drugs and supplies. Number 2, stock taking and generating monthly inventory reports. Number 3, ensuring stock items, issuing stock items, that is the drugs, issuing stock items, the drugs, and prepare prescriptions. Number 4, collecting prescription changes, all checking patient exemption statements. That's your role as a dispenser. Number 5, operating effective stock control appropriate to the needs of the dispensary. Another one, ensuring that drugs are received and stored in an appropriate manner in accordance with the manufacturer's instructions. So that's your role as a dispenser. Ensuring that refrigerated items are stored in appropriate temperature and maintaining the temperature control record or logbook. Ensuring that all dispensary equipment is kept clean and kept in good working condition. Then, maintaining full and accurate records of all dispensing transactions. Dispensing and checking repeat prescriptions. Yeah, dispensing and checking repeat prescriptions. Then, checking within patient records if concerned about appropriateness of requests for medication. Then the last one, dealing with queries from patients regarding their prescriptions. So as a dispenser, that's what you should be having in your CV. So for pharmacy technician, may be kind of related, but your roles and duties are, there's a way you can write them. Yeah. For pharmacy technician, your roles and duties are reviewing and receiving physicians' prescriptions, checking their appropriateness and legality. That's a pharmacy technician. Number 2, organizing the pharmacy in an appropriate manner to make the identification of products easier and faster. Number 3, maintaining full control over delivering, stocking, labeling medicine and other products. Number 4, monitoring the medicine condition to prevent expiring or deterioration. Number 5, preparing the medicine when appropriate, using correct dosages and material for individual patients. Yeah. Another one, keeping records of patient history and of all activities regarding heavy medication. So you have to keep that record as a pharmacy technician. Then keeping abreast of advances in medicines by attending conferences, seminars, and cooperating with other healthcare professions, say that you'll be up to date. Then accepting written prescriptions or refill requests for patients and evaluating information for correctness, for completeness and accuracy. Then delivering quality customer service to patients regarding to inquiries, questions, requests, and referring them to the pharmacists for medical information. Counting prescription medication, filling prescriptions, and typing and attaching medication labels. So that is your role as a technician. Then performing inventory audits and purchasing supplies and medication. Then last is complying with all applicable legal rules, regulations, and procedures. So that's for pharmacy technician. Yeah. So then I'll go to the roles of a nutritionist. Okay. Nutritionist, what is expected in your CV, what you should be expecting in your CV. I'll just give for a clinical nutritionist, what should they have in as their roles and duties. Evaluate all nutrition programs and review all standards and provide recommendations to various feeding formulas. Number 2, gather all information from patients and determine all energy and nutrient requirements for the individual. Then evaluate all food interactions and coordinate with all food service personnel to provide optimal patient care. Then analyze all health data and resolve all health related issues. Design all nutrition care programs and determine all plans and forecast all nutrition outcomes. So that's your role as a clinical nutritionist. Then maintain documents of all health assessment records and ensure compliance with all health standards. Provide effective education to patients, family members on all diet to meet specific requirements for the patients. So you educate the patients and also the family members. Participate in all activities associated with patients and provide efficient education to all healthcare professionals. So as a nutritionist, you are kind of specialized, so you can give education to other professions in the medical field. Collaborate with diet interns and evaluate their performance on all programs. So these student interns. So maybe I can give that. Then also I think the last one is the health assistance. Or I can give some information. The health assistance, which is more of community health. Let me look for community health. Community health. Community health. Sorry. So we have I had missed something. We have the nurse. We have also the nursing officers, who are different. We have nursing officers. Then we have the emergency officers. They are also in the field of the medical field. So let me just see the emergency officer roles and duties, what they can do. You can be at these rescue services. So we have first role, taking essential details about the patient's condition and the exact location, logging them onto the computer system. So as an emergency officer, then receiving inbound calls in relationship to customer services, then identifying and or escalating health issues for resolutions, performing triage by examining the client's medical history and signs, and entering the flow of data into the computer system, regular monitoring and reporting on emergency trends, ensuring that emergency alert systems regularly monitored and raise alerts when needed, actively participate in rapid needs assessments independently or with the program teams for that emergency the program. So participating in monitoring visits as needed, because you can do the visits, ensuring adequate documentation data collection during emergency responses. So you ensure adequate data documentations and data collections. Then supporting the internal coordination to enable rapid and effective emergency responses. Then you are supporting the procurement and pre-positioning and timely distribution of emergency supplies, because you need them. Then supporting management, documentation, and lessons learned to capture performance. Let me give the nursing officer is a bit of head. The roles and duties they can have. Nursing officer: 1, provision of quality patient care. 2, participating in the theater when assigned. 3, participating in MCH, PMCTC, surgical, gyno, and medical clinics. Ensuring availability and maintenance of equipment, stroke instruments that may be required for patient management. That's the nursing officer roles and duties. Ensuring high level of infection prevention in area. The nurse is operating to avoid hospital acquired infections. Then preparing and presenting timely comprehensive care and nursing reports as required. Ensuring patient information is treated and handled with the highest confidentiality. Then carrying out health education sessions in the department or unit and conducting orientation for newly admitted patients and new staff. Prescribing and giving nursing care to patients as necessary. Coordinating patients' care with other departments, both in and outside the ward or stroke unit. ensuring safety of drugs and supplies and equipment, maintaining drugs and other important registers in the ward, participating in the ward stroke department conference or meetings, then performing any other duties that may be assigned by the head of the department. So that is a nursing officer. Then I want to give something about these are the health inspector, the health assistant, what they should be doing. For the health inspector, 1, participate in community-based environmental health activities. 2, enforce Environmental Health Act regulations and bylaws. 3, account for allocated resources, you as a health inspector. 4, compile relevant basic health data and submit to the senior health inspector. Then allies with local authorities in organizing home improvement competitions, participate in research activities, compile and submit health periodic reports. For the health assistants, maybe I can give some few roles and duties. Liaise with public health officers to develop and implement health and hygiene promotion programs and community awareness campaigns. Then maintain relationships with community partners and coordinate local level activities that support community health. Prepare materials and deliver health education sessions, you as a health assistant. Strengthen linkage of health facilities to the community through regular feedbacks and facilitate access to health care. Then collaborate with other stakeholders in the community to ensure uptake of these health activities. Then identify people with medical problems and contact the medical team to make referrals. So you're more into the community. Carry out health visits based on referrals of health workers and volunteers. Then analyze data and submit reports. So basically, those in the health field, I was discussing the work experience. So your work experience should be having some career growth. If you are from a health assistant, then you should grow to health inspector. You get the point. You're from a midwife, yeah? Then you are enrolled, then you can go to in charge of the midwifery department or senior midwife. You get the point. For medical officer, first you are like an intern, then you go to medical officer, then you go to senior medical officer or a consultant, the like. So this always comes about with the education. So for the work experience, we have explained. Remember, on each of it, you draw. It's better you do a tabular form. A table of 2 rows. To your left, it's a small row. You put the time period from this month and year, maybe September 2021 to date. Then this other, you put the position in bold. Then down, you put the name of the position, maybe research nurse. Then below, you put employer. Then below, you put the name of the employer and the PO box address. Then below, you put the duties and responsibilities, as we have discussed. So now, from the work experience, the next thing is about education background. So education background, you'll do a table. The table is having 2 rows. So the first 2 columns. The first column, you put your latest education, maybe diploma in midwifery. Below, you put the institution and PO box address. Then to your left, you put the time period. Then down, you put the Ghana Certificate of Education, the name of the school, then the address. From the education background, you have to put from senior 4 USCE to date. Now, from education background, there are some certificates you would have done, yeah? Like a certificate in good clinical practice and human subjects protection. So, from education background, you have to put another heading for certifications and trainings. For certificates, you put the time period, maybe from June to December 2021. Then the name of the certificate in bold, certificate in good clinical practices, then who trained you, maybe Nakasero Hospital, then the address. Then there are some people who have undertaken the trainings, the different trainings or workshops. You have now some we have you have to be having a license number. So with your education background, you have to put the practicing license. You put the time when you attained it, practicing license, in brackets you put the number, the number, and you put which body gave you that practice license, like Uganda Nurses and Midwives Council. Then below you put the address. So you put practicing license, in brackets you put the number, then you put Uganda Nurses and Midwives Council, then you put the address. So you can either put it in the heading of professional bodies, registered under professional bodies, you put that, so from education background, you put the professional bodies. You can put the certificates. Then from certificates, you put certificates and training. Then you list them. You have to put the time period, the name of that certificate, then who trained that certificate, then the address of that one who trained. If it's a training course, the time period, the name of the training, who trained you, and the address. So from there, you go to computer literacy. Computer literacy, there are some softwares that you use for data collection in medicine, in the medical field. You put them. Familiar with softwares in medical data collection, or medical analysis, or medical records. Like, you put the name of that software or that program. Then you put Microsoft Office, knowledge in Microsoft Office, that is Microsoft Word, Excel, PowerPoint, and data. Then internet usage. So this, I've continued to all those professions, medical, should be having this. Then from that, you go to competencies and skills. So competencies and skills may be different. Now for the nurses, nursing officers, and also the medical people, medical doctor, clinical, let me give these competencies that you should be having your CV. Competencies and skills. 1, full examinations of the patient, medication, and prescription administration. Number 2, first aid dressing. Number 3, dispensing of medication and pharmaceutical products. Number 4, effective inventory management. Should be having that as a medical personnel. Number 5, then interpreting laboratory results. That is also a competence you should be having. Assessing symptoms and diagnosing conditions. Should be having that. Then planning, organizing, coordinating work for optimal care. Should be having that. Then investigative procedures. Having that. Risk management on wards and theaters. Then development and conducting of field surveys and data collection, because as a medical person you may be required to go to the field and collect data. Then another competence, data entry, analysis, and storage. Another competence, research and report writing. Another competence, finance management and accountability, because you should be having that, because you'll be given resources. Then the last one, decision making using scientific problem solving techniques. So that those competencies can go for clinical, the health assistants, so the clinical people. Now for and also the medical personnel, those can work for you. Now for these people in farmers, I want to get you some of your competences. Then also the ones of midwifery, you can also use those competences, because they kind of the same. I'm looking for farmers people. Now those ones in nutrition, these are competences. 1, abilities in obtaining data information and assessing requirements. That's the first competence. 2, knowledgeable in meal and menu planning. 3, abilities in collaboration on nutrition plans and facilitation of intervention. 4. Abilities in follow-up of prescribed meal provision standards and protocols. 5. Designing of special diets for therapeutical purposes. That should be your competence. Then, screening at the triage of children for early detection and malnutrition cases should be having that competence. Then, basically, that's what I can give you, those of nutrition. Then these ones of laboratory technology, those of in laboratory services, the laboratory technologists, the laboratory technician, the laboratory intern, you should be having these competences. Laboratory knowledge in regards to sample collection, 1. Performance of a wide variety of diagnostic tests, should be having those competences. Interpretation of laboratory results, then quality control and assurance, then test performance in accordance to international standards, result analysis, should be having that. Then provision of education of patients about drug adherence, compliance, and personal hygiene. Then also laboratory people should be having finance management and accountability, because you should be having that. Yeah. Then I want to get the people of nursing. I gave you it's the same thing. Or we can include also guidance and counseling. The people of so basically that's what I can give for the competences. So from the competences, you go to the personal attributes. For the personal attributes, they are unique, they are general. If you're in a medical field, you should be having these personal attributes. Personal attributes, we have organized, self-steering, and methodology with good provision. That is 1. Disciplined and dedicated to providing the highest standards of service delivery. 2. Friendly, approachable, and easygoing personality with positive outlook. Remember, you're in a medical field. Creativity, open-mindedness, and willing to learn. Another. Effective interpersonal relations with working with groups and flexible team player. Remember, you're in the medical field, sometimes work as a team. Then a result-oriented person that can work under minimum supervision. It is working under minimum supervision. Some of you say working under pressure. No, never put that. It's working under minimum supervision. Then 3, excellent oral and written communication skills, because you can communicate verbally and also, Then ability to identify, respond, and resolve the diverse needs of clients. So basically, those are the personal attributes you can put in all of you across the medical field. Then the other thing is about the hobbies. Hobbies, you can say traveling for adventure, reading books, doing sports. But some of you put these hobbies that are really don't add anything to your CV, like going to church, going to the mosque. That's not a hobby. Then conversing with friends. No, that's a bad hobby, because you might say that instead of working, you'll be in conversations. Then the other is you go to the another topic or the another heading, language proficiency. You draw a table having these column headings: the language, speaking, reading, writing, listening. So below the language, the column below, you write the language, English, then you score it. In speaking, how are you? Are you good, excellent, fair? So another language, Luganda, Runyachitara, Rusoga, like that. But basically, when you go to the languages, put the language that you know. Let the least score be fair. If you are poor in the language, don't put the language and put poor. Don't put it there, because it will make your CV look bad. Then the last is the referees. The referees that you put in the medical field, put referees that in the medical field. If you're a midwife, put the referee like a medical doctor. If you're a nurse, let the medical doctor be the referee or the nursing officer or the in charge of that facility. Don't put the HR as your referee. Why? When they call the HR in case they interview, they call the HR to ask about you. may not give them the medical part of you. They'll just say she comes early, she's friendly. But then imagine some other person you're competing with put the referee as a medical doctor. They will give the clinical practice, how the medical part of that, and that's how someone will score. So you put the referee who's above you. So you put the name and the title, doctor this, what is the position, senior consultant, the position, then below you put the contact, then below you put the email, then you put the workplace. The people your referees should have worked with you. They should appear in your work experience. Don't put someone from elsewhere. You get the point? So that's how the CV for medical is. I think now let us go to the application letter or the cover letter. The cover letter. Then that cover letter, how you should write an application cover letter. So I'll give one for a nurse, one for a midwife, then one for clinical officer, one for clinical officer, one midwife, one for, then I want one for laboratory technologist. We have laboratory technologist where we have one for laboratory technologist, because I want actually for laboratory technologist, then laboratory technologist. So all of you, when you're writing your cover letter, application letter, it's always one page. To your right, you put the address. You put your name in bold and capital. Then below it, you put the name of the facility or the workplace. Then below that, you put the PO box address. Then below that, you put your email, you put your contact. Then below that, you put your email. Then you skip a line, then below you put the date. So that address has to be bold. Yeah. Then you come to your left. You write to maybe you write to the HR, to the human resource officer. Then below you put the hospital, the name of the hospital, and below the address. That will be in caps lock. You skip a line. Below you write dear sir or madam. Never write dear sir or write dear madam, even if you know the sex of the person writing to. This is a formal letter. You write dear sir or madam. Then below, you write RE. Skip a line, write RE in bold and caps lock and capital letters. Application for the position of laboratory technologist. Application for the position of nursing officer. Application for the position of midwife. You get the point, eh? One medical field. Now, you skip a line, then you start with the body. Some of you start with the body writing. I saw the advert in this newspaper. No, that's irrelevant. I'm 20 years of age. That's irrelevant. Your cover letter application should be straight to the point. Everything you write should be adding something. So you start like this. It is with great enthusiasm that I apply for the position of laboratory technologist, of nurse, of midwife, of this medical field, dispenser, clinical officer, full stop. That's the first statement you write. Then you write, I hold a bachelor's degree of medicine and bachelor's degree of surgery from this university. I hold a diploma in midwifery from this institution. You get the point, eh? That's your next statement. But you shouldn't stop there. From this university, hence attaining knowledge and competences in, that's, you continue with that statement in. So the next words, you look at your transcript and look at the job you're applying to. If it is laboratory technologist, if it is clinical officer, if it is medical officer, if it is midwife, if it is health assistant, in my transcript, which courses did I do that are relevant to that position I'm applying to? So I can say knowledgeable. So this one was applying for laboratory technologist. So I hold a bachelor's degree in medical laboratory technology from Macquarie University, hence attaining knowledge and competences in biomedical, microbiology and pathology, hematology and blood transfusion science, clinical chemistry, serology, immunology, and immunochemistry, full stop. So you choose among 5 to 7 don't overcrowd your CV. Yeah, some of the some you can get in this, like this one of clinical officer. You can have like maybe competencies in maternal and child health care, health service management, general medicine, minor surgery, and mental health. Then maybe in those in yeah, you get the point, eh? So from there, you skip a line and go to the second paragraph where you write your experience. You start like this: my experience as a laboratory technologist at this hospital, comma, laboratory assistant at this laboratory at this. My experience as a midwife at this hospital. Then, so you write up like the latest three jobs with their there's three jobs with their workplace. Yeah, like my experience as a laboratory technologist at this hospital, comma, laboratory technologist support staff intern at this facility, and laboratory intern at this facility, has given me the opportunity to develop technical expertise in. So that's how you should write. After writing the experience, the positions, and the workplace, you continue: has my experience at this and this and this has given me the opportunity and expertise, has given me the opportunity to develop technical expertise in. Now you write these competencies that you got in your CV, like the best 5. For laboratory technology, I can say regards to sample collection, quality assurance, and quality control, test performance according to international standards, interpretation of laboratory results, result analysis. Yeah, you can write that. Then for these ones of these ones of clinical medicine, you can write maybe has given you the opportunity to develop technical expertise in regards to dispensing prescription medication and pharmaceutical products, describing medication, physical understanding patients, providing health education, patient care, health. Yeah, so you go back to your competencies and write around 5, full stop. Then you continue that paragraph. Therefore, with this education background and work experience coupled with my result, coupled with my sense of organization and detail-oriented approach to work, makes me an ideal candidate for this kind of job, full stop. Now that's what should be in the second paragraph. Now the third paragraph, you write this statement: I would value the opportunity to join your team of professionals where I could develop my skills further, full stop. For information, please refer to my CV, full stop. Skip a line. Then you write this statement: thank you for reviewing my application letter, or thank you for reviewing my cover letter, and I hopefully wait for your response. You skip a line. Yours sincerely, you skip around 2 lines where you can put your signature. You put your name in bold, you put your current position like medical clinical officer, then below you put the name of the facility, full stop. That's how your cover letter application should be written. Don't write anything outside that. So thank you so much. That has been the guidance for the medical field. Hope you have subscribed and share the link with most of your members to get guided. Thank you so much.